Okay. Welcome everyone, and warm welcome to you, Callie. Really nice to see you again. Uh, we remember the time you were here in Ottawa when we were working on your next book. A
Right.
lot of work to be done there. Huh?
Some progress being made.
Good, great, great.
Right.
Meanwhile, here comes the major crisis that we're all facing internationally. Um, For those who may not know Kali Akuno, he's the co-founder and executive director of Corporation Jackson and co-editor of one of Taraja Press's books, Jackson Rising, the Struggle for Economic Democracy and Black Self-Determination in Jackson, Mississippi. Kali, you once served as the director of special projects and external funding in the mayoral administration of the late senior Chokwe Lumumba of Jackson, Mississippi. Um, I understand the focus of your role was supporting cooperative development, the introduction of eco-friendly and carbon reduction methods of operation, and the promotion of human rights and international relations in the city. Um, Since then, you've returned to full-time work with Cooperation Jackson,
Hmm.
an organization that many of you, I'm sure, know that works with community-based cooperatives of various kinds. Um, Callie, Mississippi, as I understand it, has reported nearly 400 cases of COVID-19, although that figure is coming from CDC, and many say that that's an underestimate of what is going on.
Right.
And
Right.
here we have Jackson, Mississippi is a predominantly black city. So help us understand what's the situation in Jackson. How is the new administration of Chokwe and Tada Lumumba, not so
Hmm.
old, huh, dealing with this? Perhaps you give us some sort of idea.
Yeah. I mean, just a sense of kind of daily life right now. Things have definitely slowed down. I mean, considerably. They haven't completely shut down. The grocery stores are operating. Uh, drug stores are operating. Gun stores are operating.
Gun
Um,
stores.
yeah, the gun stores are guns and ammo are flying off
Essential.
the shelf. Essentials in the deep south, essentials in the United States of America. They are
I'm
making a
sure.
killing right now. Um, then there are a few little stragglers who shouldn't be open. Some bars and things like that. I've seen some of the fast food joints. I think all of the McDonald's are still open. A few of the Burger Kings are still open. So life is adjusted. And no question about that. It hasn't completely ground to a halt, but I think that's coming, which is why I'm leading to it. In regards to the city's response, the Mayor Antar Lumumba, Chokwe Antar Lumumba, was fairly quick in moving and kind of declaring a state of emergency, well ahead of um, what the state did under Governor Tate Reeves. Um, has done some good messaging, spreading correct information, accurate information, to the residents of Jackson. However, the city's short of resources. Um, Even in the best of times, under the old status quo, because it's not like there will be a return to the old status quo once this is said and done. However that may play out, and I'm from one. I think as we'll talk about, I think this is going to last some years, similar to what happened in 1918. Hopefully, not to the level of impact of 100 million people dead, as happened there. Which is also probably an undercount of how many people died at that time. Hopefully, this pandemic doesn't reach to that proportion. But just given the nature of social life and social organization in the United States, where we don't have a national healthcare infrastructure to manage a crisis of this nature. You have millions of people who are totally uninsured, and you have millions of homeless people and millions of people who are in some form of detention. So you put those four together, you're creating a internal kind of vector, which is going to last, I think, for years. Particularly if you look at the last two groups, those who are in some form of confinement and the houseless, the homeless, um, because they won't get adequate treatment. And the way this particular pandemic is spreading, if we look at some of the recent information coming out of both China and the one I found most interesting, a report from Iceland. Iceland was just recently able to test its entire population, and they found out that folks who are carrying but not showing any symptoms are greater than some of the initial projections. So you got a lot of people who aren't sick and who are not likely to get sick, but still transmitting and carrying a deadly pathogen around with them. And I think that's going to impact both the prison and the homeless population, and keep it circulating and keep this thing in life, for many years to come. Now, coming back to more the local question, um, the municipality is really hamstrung by what the state government is doing. That is the reality of Jackson. So I think in this moment, um, given what Antar can do, I think he's done a great job. But if the resources are not provided either by the state or the federal government to be able to deal with this kind of escalating crisis, the best laid plans and best of intentions really mean very little. And our governor, Tate Reeves, is spending his time doing Bible study live on TV as a means to address this pandemic in his state. By last count, I think there were 5 dead as of last night. I haven't checked it this morning. I'm sure that's gone up now. Well over 300 confirmed cases. We expect that to double in the next couple of days, following the trends that we've seen throughout the United States and throughout the world. Um, and the United States, outside of a few jurisdictional things, for an international audience, they're really to understand how the United States function. There really are no borders inside the United States, except for in prisons, but there really are no borders in the United States. So Louisiana is now becoming a rising hotspot, the third highest number of cases in the country, and I think it's going to probably eclipse Virginia, I think by some projections within a day or two, and directly south and west of us. And most of our good chunk of Mississippi supply chain, particularly around fuel, but also food, comes from Louisiana. So that's coming this way soon. And basically, um, the governor has issued kind of warnings, encouraging social distancing, encouraging folks to stay at home, but not mandating it as has been done in New York, California, and several other states now. And I think ultimately that's what this is going to come to. And the longer he delays this, the more deadly this is going to become in the state of Mississippi. So, I hate to end on that sour note, but the good things that the municipality has been trying to do are being undercut, undermined, and destroyed by what the state government is failing to do. That is the situation here in Mississippi.
So, what's your view of the decisions made yesterday in the Senate about making a whole lot of money available for health services, for covering uh, wages for people who are unemployed, and so on. What's your
Band-Aid
thoughts?
solutions not going to cut it. Band-Aid
Uh,
solutions are not going to cut it. And, they are trying to employ mend it, don't bend it, kind of orientation. They put it, at least by their calculations, enough um, relief measures to keep a rebellion from sparking. At least I think that's what they're hoping. Um, it made a certain kind of left concessions, at least on paper and rhetorically, that they're not going to allow for corporate stock buybacks, or they're not going to allow CEOs and shareholders to get paid direct proceeds and dividends from the relief effort. That'll satisfy some of the initial uh, gouging concerns and profiteering concerns.
uh, Damn, Kali, I've lost you. Um, Let me get you back. Ah, there you go.
Yeah, I don't know. It just cut me off. I don't know what what happened, but
Hi,
as I said,
Kali,
the
can you
internet
hear
signal
me?
was good. Yeah, can you hear me? Can you hear me, Feroz? Feroz, can you hear me?
Uh, I think we have a problem. We've lost Kali
Hello?
Akuno for the moment. Um, it looks like he's having internet problems. Well, let's give it a couple of seconds longer, and then we may have to reschedule this broadcast.
Feroz, you're breaking up on me.
Oh, Kali, this is really unfortunate. Okay, okay. Well, uh,
Can
I'm
you hear
told
me?
that, that I can't see you, Kelly, but everyone else can see you and hear you. Um, this is very strange. Um, uh, for some reason, Kelly, I lost you there, but you're back.
Can you hear
Can you
me?
hear
Can you
me?
see me?
Great.
I can hear you.
Okay, great. Sorry.
One of
For
our
some
signals
reason,
seems to be going in and out.
yeah, yeah. Um, but let's continue. You were talking about what's happening in terms of
Um,
the resources that are apparently being made available uh, in
yeah, I mean, I think
Central.
they're trying to employ all the old tricks of the New Deal as best they can. The speed at which they've moved, I think, has been astounding. However, I don't think it's going to be enough in any fundamental way to stem the crisis. Um, I think we need to acknowledge that the world, I think, now really is in depression and will be in a depression for quite some time. Um, and they're back to from this. Too much is going to shake out and not survive. But I think also, this is a profound social experiment, or at least that's how you did this to read it. Um, and what they're figuring out, at least in I think the quote unquote advanced industrial quote unquote economies, or the service oriented economies of the United States and Western Europe in particular, great adaptive capacity can continue utilizing the new technologies that have been innovated the last few years, like the medium that we're using now to have digital meetings. So we are actually working condition in this experiment that best believe capital will exploit different ways down the line. I think we're going to see a lot more casualization of workers, a lot more folks working from home, working independent contract based because it'll save money on taxes and payroll in a number of different ways without cutting into both some of their productivity. So we're not going to come out the other end of this, whatever that may be, looking the same. But in terms of this immediate situation, it's really a Band-Aid. And what they're setting in motion, just the laws of capital and its logic, inflation is going to creep in quickly, pretty soon. All this monopoly they're doing through quantitative easing, printing trillions of dollars just to keep everything afloat. And, the U.S. Treasury buying up all the bonds and that's not going to hold. It's not going to flow. It's going to create the pressures within the quote unquote market. So we have a pretty serious ride here that they don't have a clue how to address it. And how we want the outcome to be collectively, I think is our challenge, and to build a serious build and fight program to create the future that we want. Concrete demand capital, more concrete demands we have to make on the state, but we also have to look at what are the programmatic things that we need to be doing on a community level so that we come out of this ecologically secure communities than where we are right now. I mean, I think has to be paramount on the left, project.
Okay, but help me to understand. I mean, Jackson, Mississippi is a predominantly black town. So how are black people being affected there in terms of both the spread of the virus, but also in terms of what they are being offered and are not being offered?
Not being offered anything, fundamentally. Going back again to the municipal level, what the city is bearing, both the police stations, but primarily the fire stations, into emergencies. I think a creative use of the resources that the city has at hand. The work, they don't have enough sanitary equipment. They don't have enough gloves. So, if the social distancing right now is still your best policy to the degree that you can actually do that. But this is what my concern is. One of my concerns is on a local level. Given how impoverished the city, vast majority of the city's residents already are, it's not like the vast majority of people in the city can go to the grocery store and stock up on beans and rice and food. They don't have the money. They don't have, and it's my analysis of the situation, and I hope I'm wrong. I really do hope I'm wrong. Bearing me, the last 48 hours facts are bearing my analysis to be correct, but and that is that the supply chains, particularly the food supply chain, is going to grind to a halt in the United States fairly soon. So let's say you had money. One of our grocery stores, Kroger, Walgreens. The likelihood, I think, in a week or two of you finding most of what you need is going to be low. And we have to remember, one way or another, folks are going to try to eat. So we have a escalating have not situation here in the cities throughout the country. And if that food chain breaks down, you're going to have some social unrest that the country is not prepared to deal with, despite our best efforts. We may be able to do some major intervention in our local immediate base area, but throughout the city, we're not set up yet for kind of autonomous food sovereign production. That's something that we were aiming for. And for reasons in times like this, it would come. But this struck a bit earlier than any of us anticipated. And the reality is, what does exist, and including ours, is not going to be sufficient enough to be able to kind of distribute food to the community to keep the kind of anxieties down, and would come from that down. So if things don't really pick up in 2 or 3 weeks for Rose, I think Jackson, like many other places, will be in complete chaos. I hate to say that, I hate to be alarmist, but I'm one who believes that you prepare for the worst based upon the facts that are presented to you, and the facts as they lay in front of us are not good.
Yeah. One of the campaigns and struggles that Corporation Jackson has been involved with has been to counter the growth of this huge medical faculty into and eroding the areas where most Black people live in Jackson. Um, but if we are now in a situation where the existence of adequate medical facilities is going to be crucial. So, what's your view now about the facilities that are being built?
Well, I mean, they weren't built fast enough from their perspective because there are not enough beds. The beds are already in Mississippi. 2 of the hospitals have already said that they're full to capacity. I mean, my view personally on this in the long haul hasn't changed. Um, them expanding at the expense of the community is really the wrong way to go. We exist in a situation wherein there's so much over capacity in terms of built out infrastructure, old malls that sit empty and have sit empty for years, if not decades. So there's already enough capacity spread throughout the city that they could either repurpose some of the existing buildings or tear down the old structures if they're not adequate, which we know some of them just really wouldn't be, not for medical purpose, but they could tear those down and develop those. And that would be saner for the infrastructure that already exists, would keep the gentrifying and displacement pressures at bay, number 2. And then number 3 would actually distribute, for a time like this, distribute the healthcare so that everybody has to come to one area. Because remember here, one of the challenges that exists in this city is we don't have a public transportation system here. Not a real one. There's a few bus routes, I think a total of 10 within the city. So we don't have any real public transportation that exists in the city. And because of the impoverishment rate that exists here and the reality that exists here, you got at least 1/4, maybe more, of the adult population they don't have a car, don't have a motorcycle, don't have a bike. So if they get seriously sick, they're just going to be either walking around or suffering in place. And if these things were better distributed, people could at least do something in walking distance. That would be a much more saner plan, a much more sound plan, one that actually addresses human need and not profit. And the plan that they have right now is one which is based upon maximizing profit and profit realization. Um, Now, let me be clear to your question. For those who are asking, I'm not opposed, nor we are not opposed to the expansion of medical treatment in this city and in this state. We need it. Don't get us wrong. We need it. Jackson, even before this, has some, and Mississippi overall, has some of the grossest health inequalities that you can imagine inside the United States. We're always up there, one or two, in the highest amount of, diabetes, hypertension, various forms of heart conditions, um, asthma, you name it, we're up there. So we need more healthcare facilities, right? But we need them to service our communities, which means they need to be in the communities, in places that already fit. And in our case, like I said, there's tons of malls because of the intentional disinvestment in this community, and uh, uh, retrenchment that has gone on in the past 30 years. That there are plenty of spaces that they could occupy to serve human need, and we need a directive to do so. That's what our fight is really about.
One of the things that's really I find really worrying has been that in many countries it is the frontline workers, it's the cleaners, it's the nurses, it's the doctors who are actually dying from
Right.
exposure, from being so heroic in trying to provide treatment. Um, and am I right to say that these kind of frontline workers in Mississippi are largely black?
Largely black, black and um, foreign born. A good number of our nurses are from the Philippines, which is true. I'm sure in Canada. Um, Unfortunately, the nature of empire, domination of the U.S. imperialism in the Philippines, has produced an overabundance of nurses in those. So there's a kind of a factory, if you would, shipping out nurses all throughout the English-speaking world and throughout the world. I know that's also true in a lot of the Gulf states. And in Hong Kong and places like that. So we have that in terms of nurses, and in terms of a good chunk of the doctor corps here are either from Southeast Asia, Nigeria, Ghana, and Korea. So that's if you were to go in and look at what the hospitals look like. Um, you have kind of like your orderlies, which are the techs, the nurses are going to be black and brown almost exclusively in most places. And then your doctor, the higher specialized one, are going to be primarily uh, brown, white, and some black. And
Yeah,
so the workforce, it on that frontline level that you're talking about, reflects the community. And
right.
that is how we know for sure one of the first rungs of dispersal of COVID-19 will and is happening right now. Another way we know that there's going to be a great deal of community spread is in grocery stores, because outside of one that I've been in, the workers, really are sacrificing themselves at this point. Let's be honest, and they're not given adequate protection. They don't have enough gloves. None of them are wearing masks unless they have their own personal mask supplied from someplace. And the companies are not making these things available to folks. So and from that, not intentionally, not on purpose, they're spreading it to more and more people in the community, because people have to go shopping. You have to go. We don't have enough backyard food production for folks to, survive this through, like you might have had in the 30s, and before. So we know the rate of spread is going to continue to rise exponentially. Then, like I said, there's the homeless population. Jackson has a ton of homeless. Just in the time that we've been doing this interview, and these are people who I know because they live, in squats around this community. There's been 6 homeless folks who walk by, with, again, no medical protection, no medical coverage. Something is wrong with them other than another community member looking out for them. Nobody would even know or care, because most of them don't have cell phones or other types of infrastructure. And even if they do, it's by chance they come someplace will allow them to even charge up their phones, right? Because they don't have access to electricity. Um, so, without some serious measures being put in place soon, and without real consciousness emerging quickly around the importance of social distancing, you should expect Jackson and Mississippi and most of this country to have exponential growth in the severity of this pandemic.
Well, you've got a reputation as a real community organizer. Uh, Corporation Jackson has been in the forefront of bringing people together, organizing, creating cooperatives, and so on. So, what are the challenges that a community organizer like you? What are the challenges that Cooperation Jackson faces now when the state is either unable to deliver
Right,
because of lack
right.
of interest or lack of money? What do we do in this kind of situation?
That is the $1 million question, Feroz. I mean, luckily we have invested, at least amongst our core, in having cell phones, computers, internet access, so we can stay in contact with each other. But this is really taking us away from our strength, which is knocking on the doors. Pulling folks together, through engagement off the streets and bringing folks together to engage in dialogue, debate, and planning. So we've been hurting, and so the audience knows we made very early decisions almost as soon as I came back from Canada, which was February 27th. Um, we made early decisions. I think 4 days after that, we decided to just shut down. I mean, the only unit we have that's functioning right now is our farming unit, and that is for long-term strategic purposes and also seasonal purposes. This is a growing, harvesting of some plants, planting new ones, the spring crop. So we're trying to meet the emergency and anticipating things getting worse and that we need it. So they've been trying to develop some protocols to be able to continue to do that. Hopefully they'll be successful and nobody gets sick. Um, we told folks that's not something we can guarantee. And they've been doing it to this point, understanding some of the risk. But yeah, I mean, we are trying to utilize these tools for what they're worth. I think our internal team, like our staff, is done very well. We've been doing daily calls, daily check-ins, so our actual work hasn't slowed down, I think, in reality. But to be able to do it together has. And then the other piece is, I'm making a distinction just so folks are clear between like our kind of staff core and our membership. We are not doing that well in connecting with the membership, and reason being, our membership in the main reflects, again, the population of Jackson, which doesn't have money for computers, which doesn't have money for, the latest iPhone or whatever the other kind of gadget is. So we are seeing and experiencing in real time resource deficiencies in our own organization play out. And we know that these are being magnified throughout the movement and throughout, the country. And so we are trying to figure out ways to overcome that. We initially were planning on doing, what we know how to do is organize a mutual aid response. Luckily, I think for us, we stay in steady contact with folks who live internationally, such as yourself. And in this case, we were in contact with comrades in Naples and in Milan who started doing mutual aid response, food giveaways, equipment supply giveaways, in the community. Um, they all got sick. All of them got sick in Milan and Naples. And so they told us, you can't treat this like you would treat an earthquake or a hurricane or, you know, hell, even, like a civil war outbreak. You can't treat this like this because it's a different beast. They told us don't do that. Learn from our mistakes and don't do that. So we stopped that, and now we're trying to figure out how to do a modified version of it. And what we're landing and refining, continue to study and ask questions all over the world. What we're looking like we're planning on doing, if we can get enough kind of plastic, particular type of plastic sealant, is do a kind of food distribution and giveaways where we just kind of leave things at people's door or leave things at a drop station, and people come get their supplies kind of one by one to eliminate the contact, right? So if we, again, but you heard the conditionality of it. Is what we found out from some of the science there. Paper bags, cardboard is not good, right? The virus actually can live there for a certain amount of time. It's porous. So trying to avoid using that at all costs, which means going a less environmental friendly route, but one that's necessary for the times, and that is using certain types of plastic to be able to wrap things up and then distribute it. So hold on, T. So that's where we're moving. And then the what saw today is we are putting together our community production unit has put together two different types of making masks. So we are probably going to concentrate the rest of our resources, maybe even more so than the mutual aid kind of food delivery and resource delivery, because that's contingent on things being available. But what we think where we can make a concrete contribution where there should still be ample supply is the right type of cloth and materials for us to be able to make masks that we can distribute to the community. To at least beef up that level of health security in the community, and through that assess people's needs, as best possible, and also to gather information to continue our organizing work under these new terms and conditions.
I mean, I didn't mean to ask you a really difficult, obviously difficult question, but I think many community organizers.
Transformers game on me and I iPad.
Hold on, go ask mommy T. I'm on the interview. Sorry everybody.
Yeah, you should join us. Yeah, no, I think this is an issue that needs to be discussed very widely. What is it? What does mutual aid mean in these sort of circumstances? What does community organizing mean, and the responses? And I hope that you will help prompt some discussions internationally around what strategies people are learning about and what might be possible.
Yeah, we're working on that, intentionally. Some of the things I've seen, while I applaud the spirit, I do warn me. I've seen a number of mutual aid stuff, popping up. And there's a lot of good lists, but all the pictures I've seen, I'm like, ooh, no. Don't, you guys are too close. You don't have enough protective gear. So you're exposing yourself to. So we got to do this right. And that's the key question. We got to learn how to do this right. And I think learn from the experiences of others. But in the main, I think the principles of mutual aid, us sharing what we have and producing for ourselves, so there's direct people exchange to ensure that we survive, stay fit, and able to continue by pulling all of our resources and skills together. That fundamentally hasn't changed. I think it's just how do you do it, fighting a microscopic entity, which itself is trying to survive and propagate, but at our expense. So Yeah, well, I think we just have to learn how to figure out how to do it right. And the critical thing is also just figuring out how to express action and collectivity at this time. One of the things that we are trying to gear up for is really calling for a general strike here in the United States, because it's way past time. It's needed. And what really it's been floating around in activist conversations, but I know for me, the thing that made it, made me think that there may be some real not only necessity but ability to do it is this notion that's coming from Wall Street that Trump, Wall Street Journal in particular, started putting on this call that Trump and the right wing are picking up on, that 3% of the population dying is acceptable and folks need to get back to work. And that we were saying, look, no, that's not acceptable. Yes, was not acceptable, and we need to resist. And the best way to resist is to call for a general strike of those who are, those frontline workers. Particularly folks at the grocery store. I know the nurses may be a different entity, and the doctors different beasts altogether because they're actively saving lives or doing their best to. That many of them may not be able to engage and wouldn't be advised to engage, but everybody else. We need to send a clear message to, forces of capital and this state to say our lives have value. We're going to protect them. We're going to take our matters in our own hands and just shut everything down until you come to your senses and do what you need to do to fulfill your social responsibilities. And, right now, not only are they engaging in just blatant social Darwinism and eugenics, but they've, despite their kind of overtures to a left popularism to a degree, expressed in their bill about the compensation, the CEO compensation, and the buybacks, etc., and more paid sick leave and keeping food stamps alive, which he was actually still trying to cut. The Trump administration was still actively trying to accompany a push in the middle of all this. He's hell bent. Trump in particular is the mouthpiece that the free market and not a coordinated government response is what's going to save the country and defeat this pandemic. He's hell bent on proving this at all of our expense, and it may result in millions of people dying. So that's why we're looking to really call and push for this general strike to be like, absolutely not. This is not going to happen. And then beyond that, I think the other bill piece that we want to encourage, is for folks to seriously look at the cooperative option very seriously. Because some of these workers at the food plants in Georgia and some of the action that's going on in Pittsburgh, really trying to encourage the workers that if you want safe and sound health conditions and where the workers and their lives are put at the forefront, you're going to have to seize the means of production and organize it on different lines. Because as long as the capital, the profit motive is at the guiding force of what these employers are pushing for, they will sacrifice health and people's lives to keep the machine working. And they figure, and the reality bears them out. If we lose one or two, particularly in some of these low skill jobs, we lose one or two or 10 or 20 with a massive amount of employment and people needing, income, they can just replace us. And if they're allowed to get away with that, they will. We know that from history. So we got to counter that. So how to pull this general strike together is an organizing challenge that we are taking on and going to try our damn best to learn and pull out so that it's mass activities being engaged in by hundreds of millions of people, in the United States. So, next week, hopefully I'll have more of an answer for you and for everybody as to what we've learned by pulling forces together and how to make this happen under these new terms and conditions.
I mean, looking at from where I am, it seems to me that Jackson and many other places across the United States are basically they're the sacrifice zones.
That's right.
That's where
That's right.
they don't care. Um, Yesterday, I spoke with we've had a podcast with Gasheke Gashi, an activist from the shack dwellers movement in Mathare in Nairobi. And it was really interesting how he posed it that, what this virus does is help us to really understand the nature of capitalism
Capitalism.
and
That's
its
right.
priorities.
That
And I
is
think,
right.
therefore, the struggle against it is an issue of a struggle against capital itself. Tomorrow we'll be talking to Spoo Sigoti, who's the founder and president of Abakali Basmandola, the Shack Dwellers movement in South Africa, which has 70,000 members across the country. And so it'd be interesting to see what he has to say. But I just wanted to thank you, Kali, for giving time to talk about this issue, and I hope that you'll keep us in touch with progress and the way you're thinking and how organizing can happen in this situation, which is a dangerous one. But let us keep hold on to hope. Let us shelter hope, because
That's
the
right. That's
situation
right.
doesn't look so great otherwise. Okay,
We got to
so
fight through it,
thank you.
though.
Okay, thank you for joining us, Kali.
Thank you.
We'll be in touch again. Okay,
All right.
go well.